Unusually cold winter. It's always chilly, but it's been bad this year, really bad.
No, it sounds like it. I'm hoping for it because we're going to spring break to Colorado, so hopefully.
Oh, are you really?
Yeah, hopefully it keeps pounding over there. Last year it was amazing. Well, that's recreationally.
Yeah.
To live in it, that's a different story.
Right.
All right, so just to start from the beginning, on Friday, what Dr. Prince is going to do, he's going to perform multiple muscle lengthenings, which are going to be some of the muscles on the inside because your hip tends to want to go in because these muscles are overpowering the ones on the outside. He's also going to lengthen your hamstrings, medial and possibly lateral. As I mentioned, he lengthens. And in surgery, if we get full correction with just lengthening one, then great. But if he notices that we don't get full correction, we have to lengthen a couple of others. That's when it's of the hamstrings. Then to correct the rotation that we reviewed just a moment ago, you're going to have what's called a fixator-assisted derotational osteotomy, which means in surgery, we're going to place a pin that comes out, that goes into your bone here, and one in here. One is going to be of normal profile, and the other is going to be at his current rotational state. Then he breaks the bone. Once the two half pins are parallel to each other, then we know that that's the correction he wants. And we use this little gadget, and all it is a level. We call it a inclinometer, but it's a level, and that'll tell us how many degrees this pin is in respect to this one and what we want, okay? Because normally is about 45 to 45, so he's going to try to give you more internal rotation, okay? Then the fixator gets placed so he could put either an intermedullary nail, a nail that goes inside your femur, or plates and screws. Normally what we do is put a nail in the inside of the bone with screws to lock the bone, to lock the nail. You'll have either 1 to 2 here at the end and 2 at the top end. So near the hip you'll have 2, and at the end you may have 1 to 2, and that's to hold that bone cut. Then the fixator comes off. When you wake up, you won't have anything on the outside with the exception for the brace. Okay. Then he's also going to lengthen your calf muscle. It's called a gastric soleus recession, medical terms, but essentially we're just lengthening the calf muscle in order to bring it up. I am going to add something because once your knee is fully straight, then we'll really get an idea of how much toe down position you're in and how much we need to correct, because he may need to lengthen a couple of muscles here as well. The idea is that we want to get the knee straight, the foot at 90 degrees to the tibia, and correct the rotation at the femur, and correct some of the contractures or muscle tightening that he has on the inside of his hip. The surgery itself, it will take, there's about an hour before we get started, just to get you ready for Dr. Prince. Then Dr. Prince's time, imagine muscle lengthening at the hip and the knee, that can take about an hour. Correcting the rotation, that can take about an hour and a half, so already about 2 hours, 2.5 hours. Then doing the calf, that's about another hour to an hour and a half. Then an hour after he's done, closing the incisions, taking x-rays, putting on the brace, waking you up. So altogether, you'll probably be in surgery between 6 to 7 hours. There is someone that will be updating you every so often, so you have a good idea, your family knows. They have a pretty good idea. You know,
I
like that board out there. Honestly, that board that says, patients at the hospital, patients, in PCU,
right,
patients and that was kind of
So,
cool. I've
so
never
you
seen that
know,
before.
so you know exactly what's going on, because once he goes from the operating room to recovery, it'll change his status, so you
So
know.
that 6 or 7 hours includes the recovery time. You're
No, that's all in the operating room. Recovery time, then you go to the recovery room, and you'll be in there between an hour or 2 hours before they take you to your room. And any history of spine surgery?
no, I wish.
All right, so
Mine's all bent.
well, one of the things that we'll probably do is use an epidural for pain control. Did you see the anesthesiologist
Yeah, very
today?
shortly.
Yeah,
Very
so
shortly.
I would recommend using an epidural for pain control, and it's a small catheter that they place right alongside your spinal sac, and it infuses some anesthetic agent as well as pain medication. And we keep that on for 2 days, and it works really well for pain control. After 2 days, we'll take it off. Then we'll, within 24 hours, if you're doing well with the pain medications that we'll send you home with, then you can go home.
So I'm looking at probably realistically 3 days, just listening to
Say
you.
3 to 4 days.
Okay.
I like to overestimate.
Yeah, because
you're
he just
never
told me
unhappy.
he told me 2 to 5. It doesn't matter. I mean, I'll be here if I gotta be
And
here a
that's,
week.
I'd say
You
3
know,
to 4 days, I would say is a pretty realistic expectation of how long you'll be in. You're pretty healthy otherwise, so I think you'll do very good.
Good.
Then you'll be using that brace, as I mentioned. You'll use it all the time. It'll be locked in extension, except for therapy, okay? And then when you know, for showering.
Mhm.
For the first 5 days, you can't get this leg wet. Thereafter, you will be able to. You'll wait 2 weeks before you go into a pool, okay, or submersion. No baths for at least 2 weeks. We will have you come back for a wound check 10 days, between 10 to 14 days from surgery. All those appointments will be made before you get out of the hospital. Then you are gonna start aggressive physical therapy. Now, do you guys have a therapy center back home in
I'm
Port
sure
St.
there's
Lucie?
several, I'm sure.
There's
Okay.
several.
I just
That's-
don't
That
know.
was gonna be my main question for you, is can we do it there
Yeah, well,
versus coming here?
Well, see, the most important thing to ensure that this remains corrected is the therapy. So, if you're not getting good therapy over there and you come back and we're noticing you're losing what we gained or we corrected and
So
gained
we have
from
to go back
surgery,
in and do it again.
no, you're gonna have to come here and get aggressive therapy.
That's what
But-
I didn't know.
Right, the most, and we'll decide that because it entirely depends on how comfortable you are with the therapy over there, because the truth is, if it means you guys needing to either commute back and forth for, you know, at least 2 weeks so that they start the therapy here, film it, give you all the information, plus teach you and Dad on how to do it, your outcome, you'll have a better outcome. Because even if you go 1 hour a day, 5 days a week to therapy, that's not sufficient. You have to supplement it 2 to 3 times a day, 7 days a week
At
on
home.
your own.
Okay.
The most important thing is therapy, 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 and guess what? More therapy. Okay, very, very important. Okay. Now going into the risks to the surgery. One of the risks we just discussed, reoccurrence of the contractures, but we're going to avoid that. How? With therapy.
He told me, he said therapy
It's
is,
so important.
he already told me that.
Yeah. Then there's the risk from the anesthesia. There's risk of infection, numbness, tingling, weakness, nerve damage, blood loss requiring a blood transfusion. There's risk that that bone cut doesn't heal after 6 or 12 weeks, and we need to go back and either exchange the internal hardware or do a bone graft. That is very small chance of that happening, but I still need to
I'm
explain
glad
it
that
to
you
you.
do.
There's risk of infection and breakdown of the wounds and the need to go back and repair that. There's medical risks. The biggest ones are blood clots in your legs. They're called deep vein thrombosis and pneumonia. How do we prevent that? We're going to put you on a blood thinner for a certain amount of time. It's probably be between 4 to 6 weeks, and it just depends on how long it takes for you to become more active. We may need to extend it, just to ensure that you don't develop a blood clot, and it'll be a pill that you just take on a daily basis. Then the other, how to decrease the pneumonia is sitting up. They're gonna give you a breathing machine. It's called an incentive spirometer, and you use that 10 times every hour, as well as deep coughing. And usually I put it on you guys to kind of, push them, because those deep coughing and the breathing helps keep your lungs nice and expanded, help to prevent developing
When I'm home.
pneumonia. When you're in the hospital.
Oh, here.
In the hospital and at home.
Oh, both.
For about a week after you get out of the
Oh,
hospital.
I was gonna say, for how long? Yeah, okay.
Yeah, not very long. You're out of that risk within about a week or two, but it doesn't hurt to do those breathing. You'll see it's a very simple device, but the most important one that we can give you post-operatively, okay? Any questions or concerns regarding those risks?
No.
All right, perfect. Like I mentioned, you'll come back.
If I wake up, I'm happy.
You're gonna wake up. You will most certainly wake
If
up.
I wake up, I'm happy. I'll deal with the rest.
Like I said, after surgery, you'll come back to the clinic between 10 to 14 days for a wound check, and then at 6 weeks for x-rays, okay? Then thereafter, we'll discuss the follow-ups.
I do have a quick question. Now, you said therapy at home. How many hours a day?
So it's not so many hours a day, because it's at home, and if they,
Well,
in
he's
your
gonna be
gym-
coming and going, but her mom can stay too if we need somebody to stay here. Because everybody's from Michigan, but us. It's basically gonna be me and her, and my
Gotcha.
7-year-old. And he.
Well, who's ever there, the idea is that you could do 15-minute intervals 16 times a day. The idea is however you want
Just
to
keep
work it out.
repetitive.
Your homework after this, guess what? Therapy. We got to work on this. At the end of this visit, we're going to have a test. And therapy is the most important thing. You'll be able to do it. You'll see. Families are able to do it all the time. And that's why when he has his therapy sessions, we'll want you to go to it so they can teach you as well, and you know how to do it properly and that sort of thing. But what I want to drive home, the most important thing is therapy. Because we can get a full correction in surgery, but if we don't follow up with therapy to maintain it, then you'll reoccur. All right. So that's the most.
I've already done 1 million hours of therapy in my life already. I can do another 1,000,000.
Perfect. All right. So if you have no questions or concerns, you can sign this consent. I'm just going to add one thing.
I'll just determine if there's any reason for me to go to my neurology appointment tomorrow. She's the one that referred me to you guys, so she probably just wants to know what's going on.
Yeah, absolutely.
She's the one that referred me here in the first
Who's your
place.
neurologist?
Vasquez.